So let me read it out. I think there's some technical glitches in putting this slide. So number one, to the participants, please, whoever has joined, please rename to share your details. For example, name, the organization, and the country. Maybe you will look into my frame and accordingly you can rename it. The second one, this session is recorded and will be used for documentation purposes, and it will also be disseminated on our social media. The third one, requesting you to keep your microphone off.
I'm sorry, Selvin, I can't hear you. Can anyone else hear Selvin? Because I'm not hearing. Sorry.
Can you all hear me?
Yeah, so I think sometimes just a bit disconnected from our reality.
I'm so sorry about that.
You're audible. Sylvan, you're audible.
Can you hear me well?
Yes.
Yes.
Now we can hear you.
That's more clear.
Thank you. Chinmay, maybe you can put up the slides here now, please. And the third one is requesting you to keep the microphone off when you are not talking. And if you have any questions, please ask during the Q&A sessions. And also feel free to use the chat boxes, which is available here. And if you want to take the photos of the speakers or the sessions, please ask permission before them on the social media. And a reminder to be very respectful to all the speakers and the participants. Without further ado, I would like to hand over the mic to Chinmay for the next session. Chinmay, over to you. Thank you.
Thank you so much, Selvan. Hello, everyone. My name is Chinmay Modi. My preferred name is Chinmay Kumar, and I'm project coordinator for Asia Pacific Regional Learning Hub hosted by 7 Alliance. Leo, next slide, please. Yeah, so thank you so much for joining, first of all, and this is a wonderful day, right from having this initial idea to have a collective of regional organizations and working on different projects, brainstorming mechanisms and advocacies, and then actually seeing it happening is a great feeling for all of us. So 7 Alliance serves as a unified representative body for communities in all our diversities, disproportionately affected by HIVs across the region. Sorry guys, sorry for the disturbance. By sharing knowledge, resources, and information, our goal is to establish strong and sustainable mechanisms for key populations and people living with HIV. Through this capacity building, cross-learning, and advocacy at the regional and country levels within the region. We have a united consortium of regional key population networks of organizations such as APCOM Foundation, the Asia Pacific Network of People Living with HIV, Asia Pacific Network of Sex Workers, Asia Pacific Transgender Network, International Community of Women Living with HIV in Asia and Pacific, and Network of Asian People Who Use Drugs, and Youth Lead. So collectively of these 7 organizations, we are known as 7 Alliance Consortium, making sure that we are following a strategy to focus on cross-learning and innovations, collaboration and partnership, and research and strengthening of communities and networks. We also adhere to the values based on 7 Alliance Consortium thought processes. We believe the values of community responses to HIV and essential to ending the AIDS epidemic, and hence communities should be led to lead. Our collaboration is also a reminder that without community action, engagement, and support, reaching the regional and global AIDS targets wouldn't be impossible, and would be impossible. And combining the number of country partners, constituencies, member, and local focal points between all key population networks, the number of key population reached and supported is immeasurable. And also the impact of collective work alone is undoubtedly significant. Next slide, Leo. So here are our social media. Yeah. So here is our social media pages and websites. I will request everyone to follow. We have our websites already online, where you will be able to find all the Seven Alliance updates about work, about all the informations of the Asia Pacific region, as well as the major updates coming from our donors. Also, if you have more queries regarding our work which we are doing, and if you want to also be part of the work which we are doing, then you can reach out to us at our communications email ID, and also requesting to get major updates, like weekly updates, daily updates on our social media pages. We have our Facebook page, Instagram page, Twitter, which is now known as X, and LinkedIn. So like you can follow us on all of these pages, and you can get our updates regularly. Next slide, please. Also, like today it's also we are very much excited because apart from what we are doing as a Seven Alliance Consortium, one of the major update is Asia Pacific Regional Learning Hub. Um, Asia Pacific Regional Learning Hub is like a vibrant space to facilitate peer exchange and learnings, capacity building, and collaboration to strengthen the engagement and leadership of communities most affected by HIV, tuberculosis, and malaria. This initiative is operated under Community Engagement Strategic Initiative of the Global Fund, which is implemented into 6 different regions. Our role as the Asia Pacific Regional Learning Hub includes identifying learning needs. So like we will be conducting surveys within this time period to identify the high priority needs of communities for better engagements. Then we will be disseminating the latest information through our webinars and newsletters. We will also make sure that we foster community representatives, technical partners, and stakeholders to exchange insights via webinars, meetings, and scientific events. Also, one of the major focus area through Asia Pacific Regional Learning Hub will be technical assistance, which we will be learning more during this webinar. Apart from that, providing in-country community engagement support through small grants is also one of our major. There are major reasons to also follow Seven Alliance as well as Asia Pacific Regional Learning Hub to also get opportunity updates as well as small grants updates, where you can be part of the initiative. Also, highlights and success stories. So if there are any major highlights from the grassroots level, and like success stories which you want to highlight, then you can reach out to Seven Alliance and Asia Pacific Regional Learning Hub to highlight success stories. Next slide, Leo. Okay, how can this is very important for everyone who has joined, because we also want that you should know that how you can connect with us. So like as I mentioned earlier, you can subscribe our newsletters, follow our social media accounts. You can also reach out to us to seek for technical assistance support. Then you can also reach out to us to feature the work which you are doing at the grassroots level, so that we can reach out to maximum number of people in the Asia Pacific region. We will also be looking for we are also going to look for participation for virtual and in-person learning events, which we will keep on updating on our social media pages and websites. Apart from that, like applying for small grants is one of the major reason, reason, and it's important to be connected to us. Next slide. So like this is the work plan summary. I just don't want to go much into the details, but just giving an overview. We will be conducting 2 surveys one in 2024 and one in 2026, to know the learning needs and measure the knowledge improvement within this time period. Apart from that, the virtual learning sessions, this is our first virtual learning session, but during the course of the project implementation, we will be organizing 12 virtual learning sessions on different topics to cover. Apart from that, we are also going to engage in personal regional learning forums to make sure that people engaging at the grassroots level can also get exposure during the in-person meetings. Apart from that, 36 learning newsletters, so like aiming to send one newsletter every month to give our updates to the country partners, communities, and our stakeholders. Um, Also, like as I mentioned, technical assistance is one of the very important is very important initiative of this project. So like we will be a bridge between the technical requester and the technical provider, which we are going to learn in next session. And apart from that, country level engagements and scientific events and case studies is the major work plan summary, which we are going to focus from 2024 to 2026. Next slide, Leo. Um, Yeah, so as I just said, like learning needs assessment survey is one of the focus which we are going to do in 2024 and 2026. And I'm thrilled to announce that the launch of learning needs assessment survey by Asia Pacific Regional Learning Hub across the Asia Pacific region. By now, we have shared our survey questionnaire to the identified community representatives and community networks to respond on that survey. It's a crucial step towards understanding and addressing the educational needs of our communities. This comprehensive survey spans across the three key diseases. By engaging 160 community members through SurveyMonkey, along with conducting in-depth interviews, focus group discussions, and key informant interviews, we are committed to capturing the voices and experiences of most vulnerable and at-risk population. The Learning Needs Assessment Survey is focused on understanding the current situation of community engagement in Global Fund grant making and CCM processes. And we understand upcoming capacity development needs to strengthen community engagement in Global Fund country engagements. So the survey is basically focused on identifying needs of communities for the Global Fund to get engaged in the Global Fund processes. And this is where we are covering 160 community members in 15 countries and through 21 country partners. Next slide, Leo. Yeah. So as I mentioned, please reach out to us on communications@7allianceap.com for future collaborations, and also visit our website. Thank you so much, everyone.
Thank you, Chinmay, for walking us through about the Seven Alliance and also the AP Learning Hub and also the strategies of Seven Alliance. It's wonderful to hear about what we are doing at the region level and so how and what are the activities under the AP Pacific Learning Hub. Chinmay, I would also like to ask some questions, if that's okay. Maybe you can also give us a brief overview. What has the Seven Alliance done so far? So you can talk about that. And also, I encourage the participants to ask questions. If you have some question, please raise your hand, ask questions, or else drop your questions in the chat box. Thank you. Chinmay, over to you. Chinmay, are you there?
Hi, Selvan. I think Chinmay got disconnected, and he's going to join back in a short bit.
Chanton, yes, you raise your hand.
Okay, thanks you, Chimney, and also Selvan. Hello, good afternoon, everyone. This is Chanton, working with Kana, Cambodia. Maybe I think it's been, discussed so far around the roles of Seven Alliance, and as you may know that most of the Seven Alliance and Learning Hub, the member are lead from the HIV, program of perspective. So I just want to how to say to know your strategy or your future plan, how you wish to reach out to the house other community entities are working on TB and malaria, at country level. For example, like TB network or malaria group or network. So I think this is very important. To get them, on board with the Seven Alliance as well. Over to you, Sylvan. Thanks.
Thank you, Shanton. That's the reason we are doing a learning need assessment right now. So we have a consultant already on board, as Chinmay said. So we will be reaching out to some of the partners, collecting data, and also we'll be analyzing what are the needs, and accordingly we will be working on further. So of course, we are also, collaborating with some of the other partners, including the tuberculosis and malaria partners as well, because we have good connection with HIV partners. So all the 7 Alliance members are really on it. And we love to hear and receive support from the partners from tuberculosis, malaria, and HIV components as well. Thank you. Usman, you have any question, please?
Thank you so much, Selvan. I do have a question. First of all, I would say a big congratulations on the successful implementation of several alliances on the regional level. Though Pakistan is quite new in such scenario, it's in the second phase of CLM implementation in Pakistan, and we are doing it with a lot of new interventions. I just wanted to ask one thing. As somebody previously have asked regarding the program inclusion of other areas, let's suppose malaria, TB, specifically TB, or or some CSOs as well. So are you guys only the HIV specific, I mean, including other programs as well within the 7 alliances, or catering it separately?
Usman, let me jump in. If other 7 Alliance member also wants to compliment, please go ahead. So as I told you, this is a short-term TA, right? The webinar. So basically, we are looking into 3 different components.
Louder, Selvan. You are not audible.
Can you hear me now? It's
Louder.
3 components. 3
Mm.
components.
Please, little loud.
3 components: HIV, tuberculosis, and malaria. So we will be collaborating with the partners who is working on tuberculosis and malaria as well, Usman. Yeah.
Okay.
Usman, did I answer your question?
Yeah, I just got it. Thank you.
Thank you. I also seen somebody else raise their hands. Please unmute your mic and ask question, please. Yes, Karen.
Thank you so much for this webinar. Hello everyone, I'm Karen from Youth Voices Ground, it's a regional network. So my question in this webinar is how the regional network can access to the technical assistant grant. I can see one agenda is about the technical assistant grant, so just want to raise a question. How regional network can access technical assistant grant who has not been implemented global fund grant at the regional and the national level through the partners?
Maybe at this point I cannot answer this question, but other 7 Alliance member want to answer, please go ahead. But I think this will be discussed in the next session, which is upcoming right now. In there you can ask this question as well, Karen. I think that would be really helpful for all of us. Yeah. So in the interest of time, I think we should start the next session, which is introduction to the technical assistance available in the Asia Pacific region. For this, I would like to invite Ika, who is a moderator. Ika, over to you.
Thank you so much, Selvan. I hope that you can hear me. My name is Ika. I'm the regional coordinator of YouthLead and also a member of the Seven Alliance, and I will be the moderator of this session, which is the short-term technical assistance from the partners. So without further ado, I would like to invite Annabelle Metzner from the Community Engagement, Community Rights and Gender Department at the Global Fund. Annabelle, over to you.
Thanks so much and good morning. I'm just wondering if it's possible for me to share the screen because I think I don't have the right yet.
Let me try to make you co-host.
Please
Leo,
go
can you help
ahead,
me?
Annabelle.
Okay, now it works. Okay. Thanks so much for the opportunity to brief you on the short-term technical assistance that is available under the Community Engagement Strategic Initiative. And you will receive the slides from the Seven Alliance team after this call today. Just in terms of the objective of the SI, many of you are aware that the focus is really on strengthening leadership and engagement of communities most affected by HIV, TB, and malaria in Global Fund and related national processes. And it's really important for us to reiterate the focus on national processes because this is also the focus of the TA mainly. So I will mainly focus on the first component of the SI, the short-term peer-to-peer technical assistance. But just to show you again, like the overall outcomes of the initiative that the TA will also contribute to, which is really around communities generating and using data to inform advocacy and decision-making, communities having capacity to mobilize and hold their representatives and decision makers accountable. So these are really the main objectives that the TA is contributing to. We have updated our pool of short-term technical assistance providers. In the previous cycle, we were working with 26 short-term TA providers, and now the pool is a little bit smaller. We have pre-qualified 19 TA providers for this 3-year cycle, and we have all set up a contract with them, and several of these TA providers are readily available to provide short-term technical assistance in Asia-Pacific region. And we're particularly happy also to see some more TA providers from community-led networks and organizations. In terms of past overview of TA, I just copied this from our last evaluation of the GC6 strategic initiative, and it gives you a perspective on the number of assignments that we delivered by region. And you see that in some regions, there was quite a high number of requests and assignments, such as the Latin America region or ICA region, and it's also partly due to limited other TA mechanisms that can provide support in these regions. We provided in the previous cycle 5 assignments to high impact Asian countries and 7 assignments to Southern and Eastern Asia countries. So 12 assignments in total out of 134 assignments. So you see that there's definitely opportunity to mobilize a higher number of TAs in this 3-year cycle. And we're very grateful to be able to work together with Seven Alliance and some of you to mobilize the support. Just to recap what the short-term TA is there for, it's very similar to the previous cycle, and some of you know the TA menu already. We can support rapid CRG-related situational analysis or needs assessment. For instance, this could mean analyzing CRG-related barriers to HIV, TB, or malaria services. We can support engagement throughout the country dialogue and the grant lifecycle. This includes engagement in funding request development and grant making, but also in NSP review and development. And we can also support engagement in program design. For instance, we had some cases where there was budget set aside in the Global Fund grant, for instance, for HIV prevention programming, for the transgender people, but it wasn't really clear how the package of intervention should look like. So we helped with doing a consultation to actually inform the design of these programs. I want to highlight that some areas are not eligible, which include CCM strengthening, which includes long-term capacity development of civil society networks and organizations, everything related to development of strategic plans, organizational strategies, manuals, and so on. We can unfortunately not support, but other mechanisms can. And we can support consultants to do the actual funding request writing. Overall, we will be able to support around 4 to 6 TAs per region per year. And at the moment, we have a TA assignment ongoing in Solomon Islands. In terms of how the support looks like, we can mobilize experts for around 30 days who will implement in a period of 3 months. And we aim to work as much as possible with experts from the country and region of assignment. In terms of the process and how it works, we have 5 steps. At the application stage, we really work closely together with the Learning Hub, and you can bring us also into initial discussions. If you have identified a need regarding community engagement, then your task would be to complete the TA request form, which you can find on the Global Fund website, the community engagement page. You would complete it. There is a requirement for the Learning Hub to review it, and then you would need to submit it to this email address, ceta@theglobalfund.org. Afterwards, on Global Fund side, we will review the request for eligibility. This involves the CRG team, but also colleagues from the Grant Management Division. And if the request is eligible, we will provide you feedback and move to the mobilization of experts. This step includes development of detailed terms of reference and a budget, identification of experts who are available and qualified to deliver the TA. And then we are hiring these experts and move into implementation. We usually have a joint kickoff call with the consultants, with the TA requester, and then basically the TA requester leads implementation and finalization of deliverables. What is important for us here is that the consultants work very closely with you as TA requesters, and that the deliverables really respond in terms of the content and the format to what you need. For instance, we usually don't ask for specific TA reports, but the deliverable can either be a report, a consultation report that you can use. It can also be a presentation. It can also have some other format. So for us, it's really important to align with what is most useful for you to use in the advocacy locally and regionally. And then afterwards, we have newly introduced that the Learning Hub will do post-assignment interview with the requester to capture some of the learnings from the TA and feed it back into the regional learning. I just want to reiterate one thing in terms of timeline. For us, it takes around 3 months to mobilize experts, which really means that if you have identified a need for engagement or an opportunity, kindly request the TA as soon as you know, because it's very difficult if we receive requests, let's say today, to engage in the HIV NSP revision due to happen in 3 weeks, then it's really difficult for us to mobilize. And most of the time we will not be able to mobilize expertise. So it's good to really plan a little bit ahead, a couple of months, think about 2024, what are the key processes that you want to inform 2025, and really request the support as early as possible. Just a recap of some of the changes to the TA component in this cycle. We have a slightly reduced budget in the SI overall from 16 to 14 million, which has implication on the number of TAs we can deliver. As I mentioned, we have an updated pool of TA providers, and we have updated all guidance material on the community engagement page of the Global Fund, which includes the TA request form. We have a TA guidance note that you can look at. It includes a lot of very practical examples on how the TA looked like and to get a better idea of what is actually eligible. And we also have the list of TA providers that I showed you earlier online on the Global Fund website. So you can see which TA providers have expertise to deliver in the Asia Pacific region. And just important for those of you who requested TA in the past that we have changed the email address. So please use, instead of using CRGTA, please use CETA in the future. And with that, I'm handing over to Ika, and I'm available to respond to questions if there are any.
Thank you so much, Annabelle, for your insightful presentation. So we actually have questions, but I would like to finish all the presentation and we will discuss on the question afterwards. I think Bridget is joining with us. So I would like to call our second speaker, which is Bridget Quenum. She is the Science, Service, and System for All Practice Lead for UNAIDS ASEAN Pacific. As a team lead, Dr. Bridget oversees the overall programmatic implementation at the regional level in connection with the countries working towards results and targets set to UNAIDS. So Bridget, I would like to invite you. Bridget, are you here?
Can you hear me now? Yeah.
Yes, I can hear you now. Thank you so much.
Hello. Can you
Please
hear
go
me?
ahead.
Yeah. Okay.
Yes, yes.
Thank you. Thank you. Next slide, please. Yeah. Okay. So let me start about giving a few elements on the fundamentals of the technical support delivery through UNAIDS. Number one, it's important to understand that this is a demand-driven, country-focused technical support, So we are receiving requests from countries on particular thematic regarding see something on my screen. Is it in language or in English? Are you hearing me in English or not?
Yes.
Okay. Sorry. So first point, demand-driven, country-focused technical support. So countries through our UNAIDS country offices send us requests for technical support. Second point, it optimizes the global fund and government's investments based on the 5% global fund holdback, including PEPFAR, DFAT, this is the Australian Corporation, and others at country level. It also provides quality assured technical support for impactful programming. So it's really to bring quality assurance on the technical support provided so that we really get impact on that. And then it's about leveraging UNAIDS, both the Secretariat and the co-sponsors, resources to have impact at country level. And as you know, there is the UN Joint Team on AIDS at country level in the UNAIDS, we work with the Secretariat and both the co-sponsors, and more we are receiving requests from the joint UN teams where each of the co-sponsors bring his added value. On that slide, if you click, yes, the UNAIDS value proposition, I think it's important to say that this TSM is really a trusted interface with governments, communities, and other technical partners. So I think it's very important to have this presentation at this webinar really to get it to be more requested for. There is definitely an adaptability with the current political and economic climate. This mechanism also aims to be innovative and agile to deliver the TA, one-stop hub for countries' technical assistance needs, where we try to bring together TA that are coherent and integrated. And finally, the last but not the least, a robust accountability mechanism with building risk management system, because this is important for the donors that provide the money for this TA. Next slide, please. Yeah, so this next, yes, thank you for clicking and bringing the pieces together. There is a last piece you need to click on. Thank you. And the last one again. Yeah, and this slide is really to show how the PEPFAR strategy, the UNAIDS strategy, and the Global Fund strategies are aligned, you know, and no need to go into details. And TSM is at the center of these three strategies which are aligned. And there are a number of priority areas which are in support of the Global Fund grants. And most of the time, the countries ensure that there is complementarity and synergies between when they are mobilizing this TA and the resources from these different grants and the donors to make sure that they support the overall national response in a strategic manner and with impact. So here you can see the TSM priority areas. It's the TA can be in support of grant development, grant making, grant implementation, strategic information and epidemiology analysis, HIV planning and reviews, prevention, important topic, testing, treatment and care, communities, you know, to make some of the agenda around the community-led response, the CLM move forward, human rights, law and gender equality, so crucial for the work we are doing. This is about social enablers and of course, sustainable and equitable financing. Next slide, please. Yeah, so this is about the understanding of TSM resource. So TSM is being established through, this is about USAID funding from PEPFAR and also 5% of the set aside from the Global Fund. And this comes, number one, if you look on the right side, it's important to remind us that there is a clear linkage. The TA should have a clear linkage in supporting Global Fund implementation, particularly for PRs and SLs. This is short-term technical assistance provided to countries, and this is a catalytic funding to contribute to national aid responses. Important to keep that in mind. On the other side, you also have USAID standard provisions, which include prohibition on the promotion or advocacy of the legalization or practice of prostitution or sex trafficking, and also prohibition on assistance to police, prison authority, other security or law enforcement, military or paramilitary. And the eligible countries for the PEPFAR is approved by the US Congress. Next slide, please. Yeah, so yes, thank you. This is really just to show that you have intertwined approaches in the TA delivery. We have on the left side, you have what we call the TSM, the main area, the Technical Assistance Fund. And on the right side, you have the TADG, which is the Technical Assistance Demand Generation. I will come to that. For the Technical Assistance Fund, where you have the TAF, the TSM, the Technical Support Mechanism, this is demand-driven and country-focused. It's the country which requests that technical assistance, either the government or a community-led organization or another requester at country level and other stakeholders. The implementing partners are OPM, Oxford Policy Management, Genesis Analytics, based in South Africa, and ICI Santé, based in Burkina Faso. And the usual process and entry point is through technical support plans, and those technical support plans are prepared by the UNAIDS country office, who usually the team consult with the stakeholders at country level to make sure that this technical support plan is tailored to the country needs. And then the UCO, the UNAIDS country office, channel this TA request to the regional support team, TSM focal points at regional level for review, processing, so that it can be then shared with the global thematic leads at regional level, at a global center level, where we work together to make sure then that we can find the right team of consultants that is able to support the implementation of the TA. On the other side, you have the TA demand generation, where we use that TA usually for when we realize that there are key priorities areas for which we don't receive enough requests. It's really yes?
Sorry for cutting up. Can you wrap up your presentation?
Okay, let me go quickly. It's really to make sure that some areas like prevention and treatment, community-led response, human rights, gender, and equitable financing are really also taken into account and considered for technical assistance. Next slide, please. I will try to go quickly. So this was just to give an idea of the number of requests that we are receiving, number of requests in active implementation, and you can see that there are 90 countries that have been supported all over the world. Next slide, please. Yeah, so here just to say that there is a wide reach, and you have the TA in Asia Pacific in a number of countries. Around 12 countries which are eligible. Next slide, please. Yeah, so here you have the list of the eligible countries, and you have also the thematic, which there is a wider, broader spectrum. Next slide. And the last one, really where you have the resources, information and resources on TSM are available on the website, UNAIDS website, and you can find additional information there. And of course, you can reach out to us, or Michaela and myself, if needed. Over to you, and thank you for the opportunity for presenting.
Thank you so much, Bridget, for your presentation. This is really helpful. So we have, last but not least, presenter, Dr. Maxime Desmarais. Maxime Desmarais is a doctor of pharmacy from France with a master's degree in humanitarian project management and international relations. He has worked for several years on Southeast Asia, gaining extensive experience in access to healthcare products and the fight against HIV, TB, malaria, and emerging infectious disease. He is currently the portfolio manager for Myanmar and Vietnam at Expertise Fund L'Initiative. This French instrument complements the work of the Global Fund by aiming to accelerate the fight against major pandemics and help countries improve access to high-quality healthcare services by funding projects and providing the technical assistance. Maxim, over to you. You're on mute, sorry.
Thank you so much. Thank you for the invitation. So nice to meet you all. I'm Maxime Desmaris. So I'm working at L'Initiative. It's a French facility to fight HIV, AIDS, tuberculosis, and malaria to strengthen the system for health. Can we go to the next slide, please? So just a small brief, because I think it's important for you, maybe for those who don't know L'Initiative. So we are part of the Technical Cooperation Agency of the French Ministry of Foreign Affairs. So it was launched in 2011, and mainly we are providing technical assistance and additional funding through different mechanisms to the Global Fund recipient countries. And we are our main focus is to fight pandemic response and strengthen health systems. What makes the difference with the Global Fund is that we are closely linked, but we are funding what the Global Fund is not funding. So we are funding catalytic project, innovative approach to be complementary to the Global Fund. So for the cycle 2023-2025, the L'Initiative budget is 319 million. That is the 20% of the French contribution of the Global Fund. And L'Initiative as a steering committee is the one who decide all the approval for the technical assistance and also the project that are in our call for proposals. Next slide, please. So really briefly, the French Global Health Strategy has been launched a few months ago, and you can find it. It's one of the documents that frame also our intervention. About the universal health coverage, the One Health approach, gender equity, and many other area of intervention. Next slide, please. So mainly what we are trying to provide as a support, it's to accelerate the elimination of HIV, AIDS, tuberculosis, and malaria. But at the same time, we are really trying to provide sustainable approach with right-based and community-centered approach, gender equality, to reduce the impact on the climate and environment, One Health, and all the time to try to not overlap with our partners. So that's really good that our partners from Global Fund and UNAIDS make an intervention just before, because I think we are really complementary, all of us, sorry. Next slide, please. So L'Initiative, it's 40 eligible countries. For the Southeast Asia, we have Myanmar, Thailand, Cambodia, Laos, PDR, and Vietnam. But we can find a global approach, like regional approach, as soon as there is countries of the eligible countries that are included in the request of the technical assistance. Next slide, please. So how we work? Mainly, we have two big mechanisms. The first one, and I will talk about this one today, is the technical assistance request. And the other one is that every year we have call for proposal on vulnerable population, health system strengthening, operational research, to fund new and catalytic projects all the time complementary to the Global Fund intervention. Next slide, please. So I will talk now about the expertise channel. So just a brief about our the technical assistance for the next cycle. It's around 228 technical assistants committed with different beneficiaries. So we have CCM, National Program, Research Institute, an international NGO, local NGO, and community-based organization. This is mainly all our eligible organization. Next slide, please. So now just to give you some example, because we don't have specific criteria to fund, areas. As soon as it's linked with the fight of major pandemic, health system strengthening, and global fund approach and strategy, we can discuss and find a way to support the technical assistance request as soon as it's based on specific needs. This is some example in Southeast Asia of technical assistance that have been funded the last year and maybe and this year. So we have, for example, assessment of integration of mental health activity, support to develop national plan for HIV drugs. We have the development of strategic plan, resource mobilization, community communication plan, M&E framework for a Thai NGO, Swing, and many other example. Maybe the slide will be shared, so I will not talk a lot about that, maybe more on the process to request the technical assistance. This is our other example, just to give you a brief of what can be funded. It's really large. So the technical assistance request for us, it's an application can be submitted through the years. It's not non-competitive, and you just have to complete an application form that is accessible on the website. You have mainly 3 steps. To complete the application form, you have to inform the country coordination country mechanism of of your country, just by a letter or an email. And then there is all the process on the website. I will not go in detail because I know that in the presentation to go in detail in the process is not something that people will remember, but go on the website, you have English page, and it's really easy to understand. And if you have any question, I remain available anytime. So feel free to contact me. So this is the general process. You have a graphic like this, and it gives you all the information to submit. So the aim of the expertise channel is really to strengthen the capacity of the people who implement the global fund strategy, and maybe also to access and to implement global fund grants. So we are mainly a short-term and medium-term technical expertise provider. So mainly it's maximum 1 year of technical expertise. We provide local and regional expertise when it's necessary. So mainly it's what we try to provide is a national expertise when it is possible. All of the community-based organization, all the national NGO are eligible to l'initiative as soon as it's linked with the strategies of the Global Fund and part of the eligible countries.
Hi, Maxim. I'm so sorry, but could you please wrap up your presentation?
Yes. This is some tips. So for you, when the PowerPoint will be shared. Please read it and feel free again to contact me. Just to tell you that as soon as we have the request form sent internally at L'Initiative, we will check the application eligibility, make by ourselves the budget, and gather missing contextual information. So it's really a collaborative work to be sure that your technical assistance request will be approved by our steering committee. Next slide, please. So maybe just a summary, because in the agenda, this was the question that were needed in the presentation. So what type of TA support we provide is short-term and medium technical expertise with independent experts who is eligible. Mainly all of the partners are eligible except some specificity. The eligible criteria, it's really meeting a specific need. So you need to identify a need and link to the Global Fund strategy. What is the general TA provision modality? It's TA on demand, it's non-competitive, and it's really up to discussion with all the portfolio manager of the initiative. What is not supported under the respective TA support? We support mostly technical expertise by hiring experts. The activities of expertise foreseen should not already cover the budget of the Global Fund. The timeline is we have one steering committee every month that approve the technical assistant, and then it takes few months to start. The TA provider, we don't have TA provider. We launch international call for application. And again, I'm free to discuss with you about all the TA process, so feel free to contact me if you have any question. Thank you.
Thank you so much, Maxime. And also thank you so much, everyone, every speakers for the presentation today. I think this is really helpful for the community. And I'm aware that there is some discussion going on the chat box, but if you have any more questions, please feel free to raise your hand. But I think we only can have like 1 or 2 questions since we are running out of time. Anyone? I take silence as no more question. Okay, then I would like to give the mic back to Selvan. Selvan, over to you.
Thanks, Sika, for moderating this session. I think it's a very wonderful session, hearing from all the speakers and the presenters, sharing their thoughts and insights about the TA availability in the Asia Pacific region. And of course, be rest assured, all these slides will be shared to all the participants. And again, as the speaker said, if you have any questions, please feel free to reach out to them directly. Yeah, thank you. Without further ado, I would like to go to the next session, which is on the open discussions. So this session is very interesting. So we have partners to talk about the challenges and lessons learned they have encountered at the country level when accessing the TA. So for this, I would be happy to invite in Harry Prabhu. Harry, over to you.
Thank you, Selvan. Hi, everyone. Good afternoon or good evening. My name is Hari Prabowo. I'm from IPM Plus, also part of 7 Alliance. Today, I'm going to moderating a session on open discussion. We have 20 minutes for the session. And without cutting any more times, I'm going to ask the first presenter, which is Pong Chanton. Chanton Pong is a senior coordinator who's responsible for policy partnership and networking at the Khmer HIV/AIDS NGO Alliance, or KHANA. He currently serves as the project manager for several projects, including HIV/AIDS-related youth initiative, community engagement, and leadership and pandemic governance, or CELG. community right gender in TB programming, harm reduction and advocacy, and community engagement in the primary health care initiative. So without further ado, Chandon, please present. Thank you.
Thank you so much, Harry, and again, a good afternoon, everyone. This is Chanton. I work with Kana Cambodia. So sorry because I think maybe because Kana I got a message, and then Chimney asked me to share the how to lesson learn regarding the technical assistant that we got, for the Grand Cycle 7. So you're doing the Grand Cycle 7, we got only one TA, especially to support the how to say the CRG priority in the NSP on HIV review. So that's why it how to say it was not well informed or advanced. So maybe I will share this particular thing, for the next upcoming webinar. So this is just want to share the reason how to say TA that we got from the Global Fund, and then this TA actually was combined with other small grant, for example, like from Stop TB Partnership, from ACAP, and others. So that's why we to ensure that the how to say the meaningful engagement of people affected by TB, including HIV, in the global fund grant cycles and processes. So these are my the outlining that I gonna share. One is about the introduction. Second is the objective. Third is hello. No. Hello, do you hear me?
Yes, we can hear you, Chantal.
Okay. The third is methodology. Fourth is engaging in the grant cycle processes. The fifth is the key challenges, lesson learned, and then way forward. Next slide, please. So I don't want to how to say to go through much about the introduction. As you know that how to say Cambodia just developed and also submitted the country concept note to the Global Fund and Cycle, and it was accepted to implement. And then one among the how to say the grant or module, especially under the TB program, is about the removal human barrier related to TB species. So this is a very new module for TB program. So that's why the TA that was implemented is to ensure how to say the CRG intervention priority were included in the GC7 as well as costed to get implemented in the next 2 years. And then right now we are in the process of because this module is very new, so that's why the national TB program is working how to say a new to identify a new SSI in Cambodia. We call sub implementer, so to implement this particular module. So next slide, please. So this is the objective of the lesson learned. So this lesson learned, aim to document experiences of the community affected by TB, involving in the Global Fund Grant Cycle 7 processes, but not limited to country dialogue, writing processes, and grant submission. It also, to aim to reflect key priority that proposed by the community and CSO, particularly the TB community rights and gender intervention are inclusively written and costed in the grant cycle 7 for the next three years. Next slide, please. So since it was the how to say the qualitative assessment or research, so that's why we use the key informant interview as well as the focus group discussion, to collect information or data, especially the experiences or how to say insight sought from people affected by TB, people affected by HIV, CSO working on TB, HIV, Mallory, you know, to how to say to to collect the information, you know, to put in this particular, you know, lesson learned. Next slide, please. So I think, as you know, that the grant cycles when first check very comprehensive or inclusive, you know, participation from key stakeholder, including community affected by three diseases, HIV, TB, and malaria. So that's why our the TA that were used, you know, to ensure that the community and CSO, you know, were well prepared in advance, especially for the country dialogue. So that's why we use the fund to host the consulting meeting. It was called preparatory or preparation, you know, a meeting among community and CSO to identify, you know, key priority, what the specific, you know, intervention for community and also for CSO, you know, to be included in the GC7. So it was well prepared as well when the country dialogue, you know, come. So that's why they bring the community and also CSO bring this priority, you know, into, you know, the discussion. And then the affected community by TB, HIV also attended in the country dialogue because it was very, very important. And it was also a process, you know, of the Global Fund concept node development process as well. So that's why we were engaged, the community were engaged in that particular, you know, event. And next slide, please. So next slide, please. Okay. Not only just engage in the, how to say, the country dialogue. We need to ensure that the priority, the intervention, the proposed, you know, solution need to be, you know, had to be, you know, included, you know, in the final concept note. So that's why our community rep, both, you know, community network and as well as the community rep of the country coordinating committee, you know, engage in the writing process, meaning that they were a member of the writing team, for example, like
sorry, Santon, you need to wrap up soon. You need to wrap up soon. Thank you.
Okay, cool. So yeah, so that's why the committee engage in the post-country dialogue to identify, you know, top priority, engage in the writing process. Next slide, please. And then the most important thing is to have a final review. So before the how to say the CCC submit the country proposal, we had a chance to review how to say the draft country concept note. So that's why we had a chance to provide final, you know, input into the proposal. And then we also, you know, can also support it to conduct a capacity building, you know, for all, I mean, for community network and CSO working on HIV, TB, and malaria as well to understand the whole process of the GC7. So this was very, very important. Next slide, please. So this is here, you can see the, how to say, the quote, the quote, or how to say the speech from the chair of the community network one. As you can see, you know, Rasi is the chair of the BC National MSMNTG network. You know, you can see after joining the capacity building training on understanding the Bob Fund that's conducted by Kanda, I got to understand more about this one process. So that's why it very important for them, you know, to get engaged effectively. And then also Lida, Lida is a chair of the TB People Cambodia. It's like a national network of people affected by TB. So she also, it was very new for her to get engaged in the Global Fund grants and cost fund process. So that's why she get to know, you know, the whole process and then being a part of, you know, the CCC as well as the writing team. So it really, you know, was fun for her to be engaged with. And next slide, please. So this is a key challenge, as you know, that people affected by community still like in terms of, you know, technical knowledge and skill, language body, as you know, how to say all document as in English. So the local language not fully applied, so they did not understand well about those documents. You know, if affected by TB, you still new to the how to say the lack the knowledge or skill on budgeting, for example, if they were part of the writing team, so they need to understand, you know, the costing approach formula, for example, and then
Sorry,
I think this.
Chanton. Please wrap up again. Please
Last
wrap up
one.
again.
Last one.
Yep.
Last one. Last slide, please. Next one. Last slide. Next slide is last one. The lesson learned that I want to share. Okay, this is the lesson learned. Oh, can you get back? Yes. So the grant cycle one is transferable grant mechanism to encourage greater leadership and engagement of community affected by TB in raising their concern, challenge, and need for inclusion in the country education. The community affected by TB were meaningfully engaged in the entire process of the GC's event, but not limited to committees or consultation, country dialogue, writing process, and so on. Lately, the capacity building on GC's event training has, essential, increase understanding and also awareness of communities. So I think this the lesson learned to ensure that they fully, engage in the global fund, concept development process. I think that's all from my side. Thanks. Sorry for how to say a bit long. Thank Harry.
Thank you, Chanton. Thank you so much for the very insightful information relating your process in term for the short-term TA under the at the time still CRGSI, now the CSI. Anyway, so we heard about the kind of experience when they applying short-term TA, which is they using for preparation from the preparation meeting of GC7 until the capacity building of the community, and also also engaging in the country dialogue. So next one, we're gonna hear a story from a successful story of short-term TA from Chias. Vieng is gonna present it from Chias. Vieng Consurio is the executive director of Community Health Inclusion Association, Chias. He has over 20 years of experience directing various health, community rights, and gender programs in Lao PDR. He's currently the vice chair and head of the Lao CSO Coordination Committee, selected by CSO. Additionally, he's part of the CCM in Lao PDR and member of the National Gender-Based Violence and Gender Network in Lao. Vieng, platform is yours.
Thank you, Harry. So I go very brief for the sharing lesson learned from technical support program and community engagement in Laos. Next slide, please. So actually we received the technical assistance initiated for the recommendation to strengthen quality impact and also delivery of the services. The key population for HIV and TB is the Hansa one. It means Lao is why I say Hansa is the health access nutrition services. Actually, Lao is no grant global fund, but because of the global fund and World Bank is put money together to be called Hansa, it's belong to Ministry of Health. It's not global fund anymore in Laos. So Lao is the first country of the pilot for the transition for the global fund grant. Next slide. So actually we have conducted by the received the technical assistance from the CRG to conduct community consultation workshop with the civil society. Is including MSN, transgender, sex worker, people living with HIV, TB, and also people use drug. It's mostly the technical assistance is received by community right and gender term of the global fund, and also we request from technical assistance from the community, but in Lao we use the legal organization who register to apply for the TA because the government request. We have GS, PEDA, and also APL Pass is the request of the CRG technical assistant for to support Laos. Next. The technical assistant is the conduct for the for model. Is the one is the we asking for the desk review for the policy, and the second is the quality focus group discussion, and also the development of the quality tool that's the allow what's the tool allow used, and also lastly analyze the again HANSA and health component. Because HANSA health component is they including TB and HIV inside of the component. So the civil society and key population is based on the HIV and TB under HANSA project of the Ministry of Health. Yes, next. So this is the area of the TA is working in Laos. So the CRG is support for 92 people's participation. This is including key population, transgender, people affected by TB, female sex workers, civil society, people living with HIV, and also the government staff, and also ARV center staff is the health provider, including the geographic area that's the Global Fund is focused on. Is there are 10 provinces in Laos. This is the CRG is the tech lead for the consultation to find out of the result why the quality of support by the HANSA and civil society engagement is the impact or not. Next. So the methodology that the CRG technical assistant uses is the AAAQ. This is the available, accessible, acceptable, and also quality. I think this is the model that they use to support Laos. Next slide, please. Okay. So the CRG technical assistant in Laos is the support civil society. It's meaning they engage of the process to the cycle, because the cycle of the grant is the HANSA one is the finished. But when Laos is going to apply for the next cycle is the HANSA 2 because so we need to ensure that the participation by civil society is the impact or not impact, and what the scaling up that civil society need the government and Global Fund have to fulfill. So at the end, and also we try to make discuss with key population and get the result from the performance, and also the challenging and what the main challenge that we face and recommendation that we put. Next. So how TA is important for us. So because if we do by ourselves to report to the government, to the CCM, so they are not really listen. So we can make the outside of the technical assistant to support us to ensure that we can have very good data, and also we need the government and then partner. They believe about expertise. They are also the funding support, and also enhance community empowerment capacity. This is kind of the 4 component that's the government would like the TAs come and then focus on. Next. So I think this is the initial point, the priority. That's the proposal writing to request TA. So why I pushing here? So some country like Laos, so sometimes we not either first time to receive the CRG technical assistant. So we have to write very clear regarding for the statement, justify of the objective, scope of work. And also the expectation, budgeting, and monitoring, evaluation, and sustainability. So most of the important thing of the proposal we have to write on behalf of civil society, and sometimes we are facing of this quality of the proposal to submit to the CRG to ensure that it's not match or match, and this kind of thing also be challenging for us as well. Next.
Okay, can you wrap up? Thank you.
Please. Hello. Okay, thank you. So the lesson learned from the including what's done and what done. This is one thing that's we have clearly understand specific of technical need. This is I think that's a very important of this, because we try to apply the TA many times, but sometimes we don't know what we need TA for. The second about the research and know the nature of the donor. So we don't we think about the what the CRG mean and what's the expertise TA they would like to support. I think that's we have to make clear that's the what's kind of the TA that we would like to asking for. And the third one, keep regularly communication with donor and stakeholder, because in Laos sometimes if we have the TA but we not inform the government, sometimes the government not understand what civil society, why civil society need TA. And so the first one is the clearly define issue, impact, expect outcome, and community benefits. This is the main thing that we have to really focus and propose to the CCM to endorse before we asking the TA. And also the fifth one is the detailed budget. Sometimes they need more budget. They need very clear budget for the global fund. And third one is to emphasize long-term impact of maximum community engagement aligned with the country and global strategy. I think this is also need. And also transparency process. This is the so we take of 7 criteria we have to focus when we have to access for the TA. And what we don't have to do is the unclear of definition
Sorry,
issue.
Vian, please wrap up, please. Sorry, Vian, please wrap up.
Yes. Can you go to the next slide? Last one. Okay. I think the challenge for Laos is the first time is the long-term process for the approval funding. So when we apply the TA, but the TA take a long time to be approved. And the second thing is the recommendation from TA result will not be included in the global fund approved proposal. So this one is civil society facing lots of problem. Why we have the good result, but our voice not included in the proposal of the global fund grant. The third one is the ensure that all requirements are submitted. So we think that's the document we have to make clear that we have a clear report. The first one is the address the language barrier, because the TA is the English people, and then when it come to Laos, mostly key population they not speak English, so we need really translation. It take a lot of time. And also short-term TA has been approved, because if the TA come only make the report but not go to make the grant agreement, grant negotiation, and then when we receive grant is not support about the technical and support like a CLM. The last one is the national program does not accept the finding. Sometimes is the piece of the finding from TA is just make noise to the CCM, but CCM is not accept what the TA said. So 6 challenge and lesson learned from the TA civil society. I think in Laos it is quite complicated. So thank you, Harry.
Thank you, Vian. I think it's very, very informative what you just shared, particularly on do's and don'ts, and also the lesson learned. And just remember to make sure that it should be related to community engagement into global fund processes. So without further ado, let's go to the last one example from TB community, which is we have Blessy Kumar. Blessy Kumar is the CEO of the Global Coalition of TB Advocate, and she's also a health activist and public health professional with over 30 years of experience working with diverse communities in India and Sudan. She has extensively worked with tuberculosis TB affected community in Southeast Asia, focusing on barriers to women's and children access to the TB care. Priscilla has developed gender policy for many organizations and played a key role in encouraging the global TB community to view TB through a gender lens. Blessy, the platform is yours. Blessy.
Lucy.
Yeah, I was unmuted and the host had to unmute me. Yeah, thank you very much, Harry, for that introduction. So let's get into it very quickly. A very quick introduction to GCTA. We are the first global platform on TB dedicated to bridging the gap between community CSOs and other stakeholders. As of today, we have over 500 members across the globe, across 75 countries. And since our inception in March 2013, we've really been at the forefront of advocating for a people-centered, rights-based approach to TB response. This was not a term that was heard in TB before that. And we prioritize issue-based advocacy, capacity building, and coalition building and strategic communications to improve governance, accountability, and representation. And we have had some successes working with partners around the globe, advocating and seeing results in reducing prices for vital TB technologies like diagnostics and also drugs, enhanced accessibility to WHO recommended guidelines. Excuse me. Stigma and human rights really came to the forefront because of our efforts. Next slide, please. Just to kind of tell you how we do this, we take ground realities, talk to people at the community level, and then take that in a way that is understood by the policymakers and get the highest level endorsement, like you see for the human rights based TB response policy brief. We had the WHO Director General, Dr. Tedros himself launching the community a strategy document. And then we bring it back to the ground level, train people on the ground, work with NTPs, and we were able to develop the first strategy document for Government of India, Ministry of Health. And it's the same story with stigma as well. And today, stigma and human rights form the first. Next slide, please. So stigma and discrimination actually featured high on the list of the UN Secretary General's report. So communities can actually move the TB agenda right from the top level based on the ground realities that we see on the ground. Next slide, please. So in 2021, we brought together 5 regional TB networks on a south-to-south learning exchange, and a majority of it was in the South Asia region. And we were looking at what the community engagement within community rights and gender was. And we saw several challenges, especially in our region. And some of the key recommendations that the communities from the regions put up was continue to build and support strong TB community networks, coordination on advocacy and activities around that, including annual plans, consultations, strategic planning exercises, and coordination of timelines. Then key organizations, key TB organizations need to identify officials and policymakers and really work with them in countries at the national level. And of course, advocacy with donor organizations is a very crucial a part of this, and also how to move national entities to ensure that there is more sustainable funding for TB community organizations. Next slide, please. So recently, from the end of 2023 to early 2024, we conducted a rapid assessment report with a request from Global Fund in 3 countries, that is India, Indonesia, and the Philippines. And still some of the challenges that the communities, many of you actually took part as well in this. And the human rights violations in our region is quite serious still. stigma and discrimination across the board, whether it is HIV, whether it is TB or malaria communities, there is a lot of stigma and discrimination. So we looked at it and came up with some key opportunities for implementing and supporting the Global Fund advocacy roadmap that Global Fund also came up with end of last year. The first recommendation was for Global Fund to consult and advocate internally for a community organization to be a principal recipient. I think all of us would welcome this at the country level. There needs to be better cross-disease collaboration. Even today, when we look at the Learning Hub, it is very heavily on HIV just because our movement in HIV, our engagement and our activism and advocacy is much more effective. So we need to translate that and transfer that onto TB and malaria to bring people on board. TB continues to be, to a large extent, still very top-down. It's not a community-led response like we have achieved in HIV. So how can we get our TB communities also to take that step in moving towards a complete, totally community-led response? Then social contracting for community funding is very important for us to explore. Then human rights conditions. You know, these need to feature into the discussions at the country level, into the conversations around Global Fund and other funding mechanisms. You know, to really seriously look at, are the people that the donors want to support being subjected to human rights violations? It's a very important discussion. And I think many times we overstep that, or we'd like to push that under the carpet. And I think in going forward, we really need to bring this up into the highlight so that there is a level playing field for all of us to sit and discuss these kind of issues that our communities are facing at the country level. Then engagement of the private sector is also very, very important. And how can we bring communities to inform the private sector would be another area for us to look at. Next slide, please. So for us in GCTA, we have developed a lot of community support literature and brochures so that the communities can use it. And you know, the WHO guidelines that come from Geneva are in a language that our communities do not understand. So what we do is that we take it and do a community brochure on it, send it back to WHO and say, please, you know, endorse this so that our communities can understand. We did this with a highly technical topic like drug-resistant TB treatment, the shorter all-oral TB treatment. We developed a training manual and have started developing, started training communities on this. Unless and until communities are empowered with information and the right language, there is no way they can sit at the table and actually advocate for things that are meaningful to the communities. We also developed—
Sorry, Presi.
Yeah.
Please wrap up. Thank you.
Yeah. So just these are available on our website. Please do go ahead, and look at them. Next slide, please. Next slide, please. Yeah. So what do we mean by community engagement? The challenges are still just the previous slide, just for 1 second. So the challenges still in TB are very much tokenism, and we don't move beyond that. So how do we make that, you know, overcome that fear and stigma? Sustained community participation and limited resources continue to be our challenges, but it also provides us opportunities for TA to overcome this. Demand generation, How can we be valuable partners? How do we move the narrative from passive recipients of care to actually being valuable partners and a seat at the table? Next slide. So, you know, who should be providing TA? I think we've moved a long way. People closer to the closer to the community, closer to the country, closer to the region would be the most effective. We don't need people coming from across somewhere outside of our region. We have enough expertise to provide this, and it has to be very much a south to south thing. It has to be community based and community led, and we need to have TA providers in the relevant fields, and we need funding mechanism and opportunities to come up with this. And of course, you know, awareness generation on the kind of TA that is available, exactly what this webinar is doing, a simplified pathway for communities to approach the TA that is available, and also demonstrating successful case studies and best practices in TA, receiving TA like we heard from our colleagues, and also outreach conducted by TA providers would go a long way in ensuring effective mechanism for TA provision in our region. Thank you very much.
Thank you, Blasi, for such an informative slide. So yeah, so as someone living with HIV and also TB survival, I think there's, I think I'm in agreement with you. I think we should work hand in hand of like working towards the eliminate TB in the region. So without further ado, we come up with the next session, which is quick question and answer. I'm going to give it the platform to Sherry. Sherry, please go ahead. Thank you. You're muted.
Yes. Okay. Right. Thank you, speakers. I think in the comment box we can see there's a lot of questions, but due to time constraint, I think is there any pressing question that any of you would like to ask the speakers? Maybe I can take one or two questions and have a minute or two answer from the respective speakers.
Hi, Kerry. I don't have a question, but I have a response to Khana and to Lao. It is regarding their presentation, and as well as I was following up their chats in the chat box, and we will make sure that we'll reach out to them and try to arrange a call for the detailed discussion with Global Fund as well. Thank you so much for the presentations.
Yes, great. Anyone else?
Also, sorry, the one more comment. As Blasi mentioned that it has been more focused over HIV during the past years, and now we also need to focus on tuberculosis and malaria. So I just wanted to highlight and give more push to the participants that definitely Blessina is right. The Learning Hub is not just about HIV. We are going to equally work and focus towards HIV, tuberculosis, and malaria all equally. So we are definitely open for the further discussions, for technical assistance and other support as well for HIV, TB, and malaria, 3 of the diseases at the same time. Thank you so much.
Yes, thank you, Chenmi. I think it's really clear what the action plan will be from here and onwards is to definitely have a learning needs assessment where not just the providers, not just our community leaders, but everyone to have a strong communication, clear transparency needs with each other, and of course, then from there we can not forget any community or don't take any of their needs seriously, because again, I think when we talk about community needs, it could overlap, and we as the leaders, we as the providers or know of these resources should be the one that always open the doors and provide. this opportunity. And if not, I think I will going to ask one more. If there's one more time, if there's any question or any pressing matters anyone want to highlight before I can let the host to close the ceremony.
Hi, Sherry. Just confirming, like, if there are no further questions, we can go on to the next. Yeah, Selvan is here. Thank you, Selvan.
Thanks, Sherry and Harry for leading on the session, and also to all the speakers who share their very rich thoughts and experiences. And also, this is not only the platform for share your thoughts and experiences, and also the challenges. We are also doing the consultancy project right now, wherein we have developed the tool, survey tool, which is under the finalization process. And this will be actually sent to all the partners and the committee members for them to give their thoughts and experiences, what they think about, accessing TA, etc., which is more on the HIV, tuberculosis, and malaria. And that will be sent to all soon, maybe next week. So please feel free to, include your thoughts and send it to us. And this will be further processed. And then the Learning Hub platform, or else the 7 Alliance Consortium, will be further supporting you based on the results from the survey. Thank you so much. Having said that, I am going to invite Francis from NAPU, which is also part of the 7 Alliance Consortium, for the closing remarks and also for a short picture announcement, right? Francis, over to you. Thank you.
Thank you, Sylvan. Good morning, good afternoon, good evening, everyone. On behalf of the 7 Alliance Consortium, I would like to thank you all for joining us today for this webinar about the launching of the Asia Pacific Regional Learning Hub and introduction to the Community Engagement Strategic Initiative Technical Assistance, CESITA, program to support the community engagement in the Asia Pacific region by the 7 Alliance Consortium. We appreciate you all taking your time to learn more about this important initiative. But before the last words, can I please request all of you all to put on your cameras for a group picture, a nice group picture, please. Fantastic. Can I request Leo to do the needful? Or maybe like we say in India that hum honge kamyab means we shall overcome. Can we have a sign of victory, please? Are we done, Leo?
Yes, I took the
Sorry,
picture
wait a
already.
second. Wait a moment. Okay, everyone. 1, 2, 3. Okay, another one. 1, 2, 3. Okay, thank you.
Thank you so much, Leo. We do hope that this webinar was useful and informative to all the participants. We, as the 7 Alliance Regional Learning Hub, are here to serve as a valuable resource for the community representatives and the civil societies organization. And our focus is on strengthening the leadership amongst the communities most affected by HIV, tuberculosis, and malaria. First of all, I would like to convey a heartfelt thanks to Annabelle, to Bridget, and to Maxime for providing us the details, firstly, about the the application process of application for the TA process. Also, it was great to hear from the TSM how it is aligned with the Global Fund strategies, of course, with the PEPFAR and UNAIDS strategies as well. It has got a clear linkage in supporting Global Fund initiatives that provides demand-driven country-specific support and helps to optimize Global Fund and government investment at the country level. Expertise France is yet another very strong TA support mechanism that complements the Global Fund program. And it's, with its One Health approach, it is yet another window of TA support for Southeast Asian countries. The best thing is that they do not have any major funding criteria, but as long as it is connected to any major pandemic, it is ready to support. I would convey a big thanks to Chanthon, Vieng, and Blessina for sharing their experience of GC6 experience of TA provision. Your presentations were impressive, and we at the Seven Alliance are inclined to learn from your rich experience. We affirm that the community engagement SITA would help in building the capacities of communities and CSOs within the AP region. But please plan well ahead of time, because it was repeatedly informed that it is a cumbersome, a lengthy process. It may take 3 to 4 months for the approval. So please plan well ahead of time. Of course, we from the communities, we definitely agree and strongly believe health rights are human rights, and people do not lose their rights just because they identify themselves as key population of any risk group, including HIV, TB, malaria. You can stay connected with the Seven Alliance Consortium, and we encourage you to visit the Learning Hub website to learn more about the resources and opportunities available and learn more about our work. We will be putting in all details of the upcoming events and opportunities, and that may be of interest to participants. Thank you, everyone. Thank you for your time. It was a power-packed 105 minutes. Thank you so much to all for your time.
Thank you. Bye-bye.
Thank you, everyone.
Thank you. Bye.
Thank you.
Harry, stop it.
I'm ending the meeting for all, right?
Yeah, I'm ending.